In this lesson, we will study primary lung cancer. First of all, let me introduce myself. My name is Zhang Shuguang, from the Department of Thoracic Surgery, the first affiliated hospital of China Medical University. The reference book for this part is the 9th edition of surgery published by People's Medical Publishing House and the workbook, but there is no corresponding English version of these two books. You can choose other surgical textbooks, of which the lung cancer TNM stage or the 8th edition must be used. Only in this way, the latest content can be guaranteed. Pulmonary tumors can be primary and metastatic. Primary lung tumors are classified as benign and malignant. Common benign lung tumors include hematoma, inflammatory pseudotumor, etc. Malignant lung tumors mainly include lung cancer, sarcoma, carcinoid, etc. In this lesson, we will talk about primary lung cancer. Learning objectives of this part. First, master the clinical manifestations, diagnosis, and treatment of lung cancer. Second, be familiar with the etiology, pathology, TM stage, and treatment principle of lung cancer. Third, understanding the pathology classification of lung cancer. First, let's look at a case, an 18-year-old male patient with Cushing syndrome. The main manifestations are baby face, multi-blood appearance, centripetal obesity, aching, purulent, etc. Then look at his CT scan. Solid mass about 2 cm in diameter was found in the right lung. What's the possible diagnosis? After finishing this section, let's look at this case again. What is lung cancer? Lung cancer is a type of cancer that begins in the lungs. It's an abnormal growth of cells in the tissue of the lungs that form large masses known as tumors. Introduction. Lung cancer has the highest morbidity and mortality worldwide. Lung cancer is related to smoking and the environment. And the incidence of middle-aged women who have not smoked has risen in recent years. This figure shows the incidence of lung cancer in different countries. The darker the color, the higher the incidence. Etiology. External factors include environmental factors, smoking, air pollution, lamp black, occupational exposure, etc. Chemical carcinogens, nitrite, smoking, dietary factors, low fruit and vegetables intake. Internal factors include family inheritance, gene mutation, such as P53, EGFR, ALK, RAS, and etc. The packing of cigarettes has shown that smoking can cause a variety of tumors, including lung cancer. There is a documentary called Under the Dome, which is about Chinese smog and air pollution. This is the main reason for the high incidence of lung cancer in China. Asbestos is a strong carcinogen that can cause lung cancer, especially in Yunnan province, China. Then we talk about pathological classification. Gross pathological classification. Central lung cancer originates near the bronchial opening of the lung segment and is located near the hilum. And for peripheral lung cancer, originated far from the opening of the segmental bronchi and located in the peripheral part of the lung. Histopathological classification. Lung cancer can be divided into two categories, small cell lung cancer and non-small cell lung cancer. The main type of non-small cell lung cancer include adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. Characteristics of different types of lung cancer. Please study this part by yourself after class. Squamous cell carcinoma of the lung adenocarcinoma, and small cell lung cancer. This is the evolution of pathological classification of lung adenocarcinoma. Now we use 2015 WHO lung adenocarcinoma classification. We should know this. Classification method. According to the linear relationship between the occurrence and the development of lung adenocarcinoma, pre-invasive lesions include AAH and AIS. Minimally invasive adenocarcinoma is MIA, and the conventional invasive adenocarcinoma is IAC. This table shows the ground glass component, the solid component, and the relationship with the pathology of the nodule. The more solid components, the higher the malignant degree. This image shows the CT scan and the pathology of AAH. This is AIS. The tumor cells grow along the alveolar wall without clefts. CT value is very low. And this is MIA. The solid part is about 5 millimeters in diameter. There are 3 ways of metastasis of lung cancer. First, implant metastasis, mainly pleural cavity. And second, lymphatic metastasis. Third, hematogenous metastasis, lung, bone, brain, liver, adrenal gland line. This figure shows the common size of lung cancer metastasis. This table is the lung cancer TM staging system. This table shows the description of TNM in detail. This slide shows the difference of the 7th and the 8th edition of lung cancer TM staging system. This is the staging table we are using now. Clinical manifestations of lung cancer include the early symptoms of lung cancer are lack of specificity, and the clinical manifestations are related to the location, size, compression, invasion of adjacent organs, and the metastasis of the lesions. The early symptoms include irritant cough, blood sputum, fever, chest pain, shortness of breath, local compression symptoms, and symptoms of distant metastasis, and paraneoplastic syndrome. The case mentioned in the beginning is a lung cancer patient with Cushing syndrome. This picture shows 10 signs and symptoms of lung cancer, from chronic coughing, coughing up blood, to unexplained weight loss, nail climbing. Medical imaging examination include chest X-ray, chest CT, ultrasonograph, ECT. ECT used to finding whole bone metastasis, and head MRI detection of brain metastasis, and PET-CT for whole body metastasis. And chest CT is the main diagnostic method. Pathological examination methods include sputum cytology, bronchoscopy, EBUS-TBNA, mediastinal TTNA, hydrothorax examination, biopsy of metastasis, and thoracoscopy. Differential diagnoses include tuberculosis, lung inflammation, and other lung tumors. Treatment. Principles of treatment for non-small cell lung cancer is according to the principle of stage. As shown in the table, surgery can be used in stage 1A to stage 3A. For small cell lung cancer, early stage is suitable for operation. Radiotherapy and chemotherapy are more sensitive. Surgery. Standard operation. Standard operation is anatomical lobectomy plus systematic lymph node dissection. Extended resection includes double lobectomy, sleeve lobectomy, and total lung resection. Local resection is wedge resection and segmental resection. Surgical approach include thoracotomy and thoracoscopy. Multidisciplinary treatment include radiotherapy, chemotherapy, targeted therapy, and immunotherapy. This is the summary of this section. Lung cancer has the highest incidence rate and mortality rate in the world. Chest CT is the main diagnostic method. The treatment of lung cancer should follow the principles of staging. The standard operation method is anatomical lobectomy plus mediastinal lymph node dissection. The prognosis of early lung cancer is good. Early detection, early diagnosis, and early treatment is very, very important. Thank you for your attention. If you have any question, please don't hesitate to contact with me. Thanks again.